Hello everyone, welcome once again. This is Dr. Marian Davis. It's a pleasure to have you. Welcome to my office. Today I'm going to be showing you what I do and what I love to do in podiatry, okay? So today we have a minimum invasive surgery going on right here in the office right now, and it's going to be a correction of a bunion deformity. Again, welcome. This is where it's home to me. We love doing bunion surgeries here, hammertoe surgeries. Come in and see. All right, so here is our little procedure room. As you can see, you've probably been here in my other videos when you saw me doing some minor procedures. But today we're going to be doing the bunion surgery. So I have to put on my lead gown. We're pretty much all set up, ready to go. Check the vitals for my patients, and the operating table is set. The instruments are all set. We're ready to go. Okay, first, as you can see, we're just going to get the patient very comfortable. And as you can see, I'm marking the patient's limb just to make sure that we both agree on the exact foot that we're going to be working on. And I will spray the foot with alcohol and give it a good clean before I give the local anesthesia to the patient. And I always tell the patient this is going to be your first cleaning. And then I go ahead and use a little cold spray that helps the patient manage well with the injection. And we just go ahead and infiltrate the area with some local anesthesia to make the patient numb. I'm going to go ahead and start one of my preps as well with some chlorhexidine soap and just give it a good wash. Again, this is, I would say, probably the second prepping of the foot before the bunion surgery. As you can see, this patient's deformity is quite severe, and she's been very anxious about it, having difficulty wearing shoes. And now you can see how I prep myself in preparation to gown up for the surgery, and this is all done within my own office. This is an office-based MIS bunion correction. So just as we gown in the hospital, the same way we gown in the clinical setting. In this patient, at this point, the foot is already numb. And I just fully gown the patient up, keeping everything nice and sterile. And the patient is very comfortable. And the great thing about all of this is that the patient is awake and the patient is able to communicate with me. The patient is able to listen to some music. And I'm going to explain to the patient what I'm doing. And the very first thing I do is pretty much is to shave the bunion bump down. I make a really small stab incision on the medial side of the bunion, and I free up all the tissue to get over that hump of that bone of the bunion. And you can see with my burr, my hand device there, I'm able to gain access to that bump. And I'm going to use what we call an in-to-out technique just to gradually melt down that bunion bone, just burr it down, and that's it. And in this particular case, you can see I'm already putting the sutures in. So after burring down the bone, I did a little bit of an osteotomy procedure just to kind of also cut the bone and shift the bone in. The patient also opted to have a second hammertoe correction as well. You should be able to see that the incisions are very tiny with just small sutures. And this patient has done so well. A lot of the swelling that you see on top is from the anesthesia that was given to the patient to numb the patient up. And you can see how nice and straight that second toe already is. And sometimes it's so hard to find the hole. As I try to place a suture, it's very difficult to find the hole. As you can see how soft the bunion area is now because there's no longer a bony deformity there. I'm going ahead and put a skin prep an adhesive to allow my taping to take place and to be more effective and strong. And I just go ahead and correct the deformity by taping. And as you can see, the surgery is pretty much over. Just a good strapping of the toes, keeping it very, very nice and straight. And I also strapped the second toe as well, the hammer toe, which is now completely flat. And as you can see, the bunion correction is complete. So thanks for coming in to see this case. I hope you keep learning from our podcast. Make sure that you subscribe to our YouTube channel. I hope to share more cases with you. Bye-bye.